Thyroid Secrets. So, did you know that 80% of people that are on thyroid medication still report not feeling the way that they want to feel? They still report the same symptoms. They report being tired, having headaches, being slow bowels, having their hair fall out, their nails brittle, dry skin. These are all hypothyroid symptoms. 80% of people on medication. So their labs actually look fairly normal. Did you know that I have had numerous people, clients, after coming into my clinic, they actually start getting well, and then their thyroid medication makes them hyperthyroid by medication or hyperthyroid on their lab testing to where they have to reduce it down. Their doctors are actually reducing it down for them while looking at the numbers on the testing that we run. Did you know that the gold standard of thyroid is one singular test, and there's more than 9 or 10 tests that on an average day that I run, much less more tests out there that you can run. So did you know that T3 is the hormone that actually goes into your cell that causes all of the mechanisms to happen that thyroid is supposed to control, but your body makes mostly T4? And then the main hormones out there that are on the market, like Synthroid, which is a medication, levothyroxine, which is a medication, or even the natural ones like Armour and Naturethroid, are for the most part T4. Now, the bioidenticals have about 25% T3, but that still makes them 75% T4. And T4 doesn't work in the body until it's converted by the liver and the small intestine. Did you know that inflammation can decrease the ability for hormones to get in cells? All of these things are factors that you have to pay attention to when you're working with the thyroid. So every patient that comes into my clinic or client that calls me on the phone that says, I'm tired, check my thyroid, I say, okay, I will, but that may not be it. And then they always get this really sad feeling or this really sad face or sound to their voice when they don't have a thyroid problem. Because it's not the thyroid, it's something else. Or it's the TSH is normal and it's something down the line in the thyroid testing or in the inflammation testing that's causing the thyroid hormone not to work. So just to give you a little bit of an overview here, let's talk about how the thyroid works and why thyroid and infections is such an intricate balance that you have to work to get someone well and get their metabolism going, to get their immune system going, to get their bowels moving so that you can get better from the infections so that you can get better in the thyroid. So it's this big circle that goes around and around and around. So here we go. To make energy, your brain has to send a signal to your pituitary gland called TRH. That signal tells your pituitary gland to send a signal to your thyroid. That's called TSH. Then the thyroid spits out a bunch of T4 and a teeny little bit of T3. Again, T3 is what you use in your body. That T4 has to go out to your liver and into your small intestine to get converted over into T3, which then goes to your cell, causes all those beautiful mechanisms like metabolism and bowel movement, immune system regulation, recovery, all of these things to happen inside the cell. And then the cell lets the body know that we have enough T3, and it keeps this little loop going. But at any given point, if you have an autoimmune condition, it can attack that loop and break it down. And if you have inflammation, it can block the cell so that when your hormone's trying to get in it, it can't. The receptor's blocked, so then it bounces right off. So inflammation is going to play a role in there. You also have to be able to absorb all the nutrients you need to be able to produce the hormones. Iodine is one of the most favorite things out there that all kinds of people say you should be using. And in some studies, iodine shows that it increases your likelihood for autoimmunity. Now, that is true that I have seen this happen, but iodine is also necessary to do so many other functions in the body. It's antiseptic. You need it to produce hormones, and if you're malnutrition, then how are you going to do that? Meaning you have leaky gut, that your digestive tract doesn't work right. You don't absorb properly. So to get the thyroid to work properly, then we've got to get the infections out so that the inflammation goes down, the absorption goes up, and then the thyroid can work right. But to get those things to happen, you got to get the thyroid to be able to get the body to go to the bathroom and to kick the immune system on to attack the infection. So what do you do first? You do it all. You do every bit of it. So a lot of times this takes some support in a lot of different ways. So we've got to support the body as we move through here. And some of the confusion that I've gotten from people that I work with is, but you're a natural doctor and you're supporting processes without fixing the process. You're just giving me something for support, which I honestly don't like to do. If you've worked with me, you know that I try to stay as minimal as possible. But you've got to use something to get the bowels moving before you can get the thyroid to work. So you use some Aloe 450, use some bowel mover from Cellcore, use some mag citrate to get the bowels moving. And then because the liver's sluggish, because the thyroid's not making it go fully because you haven't got the thyroid working yet, you support the thyroid from supporting the liver. So then we go to support the liver with kidney liver detox, with Tudka. Both of those are from Cellcore, or you use Clearavite from Apex or Medicrin from Apex. So those are some products there. And then from there, you use lymphatic detox to get the lymph draining. You use Reparavite for the digestive tract to help repair the digestive tract lining. And remember, if your thyroid is producing hormones and now you've supported both the liver and the digestive tract, it's going to start converting hormone better. And then I also, if it's a conversion issue, meaning that those two organs are the problem, I feed those with something called Thyroid CNV, so thyroid conversion. It's a supplement that I use from Apex, but I use it because it's the conversion factor. So it's got the seleniums in it. It's got the cofactors of thyroid hormone production and conversion. So if you take those herbs and supplements, then you're going to push more thyroid hormone in. And by more thyroid hormone going in, then you have more T3 out to your cells. By detoxing the liver and flushing the digestive tract, you have less inflammation in your body. Therefore, your thyroid starts to kick up in its actual function. So you may not have had a lot of things that were off in your thyroid labs, but then all of a sudden you feel like your thyroid's working better. You might even have a reduction in swelling in your throat. You might have your hair start staying. You might have the outer third of your eyebrows staying in because you have now got the thyroid hormones being absorbed and the body's actually responding like thyroid is working. Now, the other side of it is I've seen on 1,000 occasions, thyroids actually start to work, meaning that the thyroid labs start to come into normal. Or for those who are taking hormones, they have to start reducing them because now the body's accepting those hormones so much more. Now, I haven't even talked about the infectious load yet. Now, once you start removing infectious load, the inflammation and toxicity reduced, meaning that you can reduce those other supplements away, that you actually are able to produce hormone more effectively because the body isn't so strained and stressed, and your cortisol levels going down, which blocks up everything in the body, slowing everything down. Now, as you get rid of more and more and more infections, your body requires less hormone. I have watched people come off of 125 milligrams of Synthroid all the way down to 0 over a 6 month to a year portion of time. And then the blood tests the whole time, because their medical doctor was managing this, that prescribed it to them, all the way down to 0 on that hormone. And now they feel good and their fatigue went from 10 to 0. This is incredible, right? Not only did you get to feel better, but you got off the medication you were on, regulated by your doctor, so that they could watch and see you heal, so that they know it's possible. All right, so I didn't talk specifically about one infection and how you treat it and the thyroid magically works, because it's all of them. It is the mechanisms that are within the body and optimizing them that allows you to get well. So if you're thinking about, man, I don't feel good, my energy's low, my brain fog, my hair, and all of these other things, then by piece, supporting each mechanism, supporting gut, supporting liver, flushing all that out, giving the body the conversion supplements, and then getting rid of the infections, and then repeating that process, you are going to reach a point where you are able to be fully well. And that's the goal, to be off the supplements, off the medications, and living your best life, loving every minute of it. All right.